Hello. Okay, so I am doing the recording for the assignment. Apologize, it's so dark. And for the way I am, it's been a very long week. So anyways, for my experiences with healthcare informatics. So whenever I was like in my clinical rotation as a NPTA school, I had to have access to patients' records, like especially like past records passed down from their physicians and stuff like that on why they refer them to physical therapy in the first place. And so I would have to have access to their records. That is important. So I can be able to see like their history and if they had a procedure, or, like why they're having pain, or like the physician says like maybe an issue, like if it's maybe a certain nerve that's being compressed or something like that. If they have x-rays, MRIs, or whatever. Um, it's just good to be able to have that history and be able to look at their records. And this will also tell us like maybe what kind of interventions will be good to perform on these patients. What type of interventions are like prohibited. Like, for example, why it's been a long week, my mom had spinal surgery. And so um any like contraindications for her would be like bending, twisting, and lifting more than 10 pounds. And so knowing that kind of stuff is good to know, like, okay, with this patient, we have to make sure like we're log rolling. We're not using any like heavy dumbbells if we decide to do anything, and it tells us what kind of interventions this individual might need while they're seeing us today. Um, so experience I've had with healthcare informatics as a patient, that would be like having access to my own personal health records. So through like my clinic that I go through and stuff like that, my doctor and their clinic portal, I'm able to, log on my own and see my own personal health records, which is really nice because once I get like lab work done, or if I get an x-ray and those x-rays are ready, they basically get posted first through my patient portal, and I am able to see all that stuff. And before like anyone calls me with like a results, I'm able to notice the results. And this is really nice to have because it just like prepares me, and like it makes me like come up with questions I might want to ask the doctor. Like if I have lab work done and I have questions about the lab work, when they call me to give me the results, if my questions don't get answered while I'm on the phone with them, then I can personally ask them my own questions. That way they don't call me with the results and then I don't have any questions for them. And then later on, I'm like, oh, wait, I do have a question about this. And now I'm not trying to have like a hard time to get in communication with my doctor and stuff like that. Participated in telehealth. Yeah, I have in a way or sense. I didn't like do any type of telehealth interventions with a patient personally, but I've been shadowing some OTs and stuff like that. And one my shadow did, well, with two of my shadows, they did therapy interventions through telehealth, telecommunication, and stuff like that. And it was very handy, and it's very nice, especially because I spent a lot of time at Jordan Valley with the OTs in there, and people come from all over Missouri to come get healthcare at Jordan Valley, and sometimes they drive hours and hours for an appointment and stuff like that. So, whenever they come down to Jordan Valley, they don't want to just come down for one appointment. They make several appointments. That way, they make one drive and that's it. Well, the OT there, after their first visit, they decided to do the next visit through telehealth. That way, the patient's mom doesn't, because they work with kids, the patient's mom doesn't have to drive her kiddo all the way down to Jordan Valley just for that one appointment and drive them all the way back home. Um, so that's a very big benefit, especially for patients, so that they don't have to drive a long ways just to be able to make their appointment. Um, a downfall with that is that, like, if maybe mom's not understanding the exercise very well, or maybe the patient, if they're an older patient, isn't understanding the exercise very well, you can't provide like hands-on tactile cues. You can't provide any like hands-on assistant and stuff like that because well, I mean, it's through telehealth, it's through the computer. You can't physically guide them to perform these interventions correctly. How has healthcare informatics benefit you? Well, just like as mentioned in like the previous questions, as a patient personally, just being able to access my own personal healthcare records, determine if I have any questions about my healthcare records, or just having access to those things. Because sometimes I know, like, with my mom before leading up to this surgery, there's a lot x-rays that has to be done, MRIs and stuff, and without having access to that, sometimes she like went weeks without hearing from any results or seeing any pictures or stuff like that. And then she doesn't know how to get to her healthcare stuff, and it's a big old thing where like she never asked me to try to figure out, but I probably couldn't, just because she's like constantly switching through clinics, and sometimes she'll go weeks without a result, and then she'll finally contact them and they're like, oh yeah, we have them, but they like never reached out to her. It was kind of a weird situation. So like that's how like it benefits, so I can have my access to my own personal records. Like as a clinician, I can have access to patients' records from the past and from other clinics, so that I can personally see their history, personally see what's been going on, what's been looked at, and stuff like that. Downfall to healthcare informatics would be like, in my opinion, I mean, there's just easier ways for like HIPAA to be broken with healthcare informatics, just because like maybe a nurse has someone's chart pulled up, but then something happens, like cold blue on the floor or something like that, and they have to take off running. Like that chart just kind of stays open. And yes, there are steps and ways to prevent that, but that's still just kind of like a way I see how it's a downfall. And then when we think about our older population, I mean, they didn't grow up with technology. Technology is constantly advancing, and I'm sure, like me personally, it's hard for me to keep up, and I'm sure it's even harder for them to keep up. And so they might not understand how to have access to their personal health records and how to take a look at that. What type of health informatics have you seen be more impactful for complying with treatment? I think trying to have like those physical pieces that they can see, like being able to bring up a computer screen, like here's where you started, here's how you're doing, and here's why we need to continue this path of treatment to get to this goal. Just giving them like visual cues, even like educational videos about like, oh, this is why we're performing this treatment and this is how it's going to help, or like visual like images on the computer, like here's what's happening with your body now and here's what we need to happen, this is how this treatment's gonna help that. So yeah, it's just providing a nice little visual pieces, I think, will help the best for patients to comply with treatments. But yeah, that's all I got for mine. Thanks for listening.